Ready? Go.
Hi guys, and welcome back to Codemaster Coach, your medical coding tutor. As promised, I'm coming up with a video called Medical Coding. What is it? I've got some notes, so I want to make sure that I stay on track with everything that I want to say. So if you see me looking down, you can understand why. But medical coding is assigning a code for diagnoses and procedures that are performed in a healthcare setting. Numerous times I've seen advertisements for become a medical coding or become a medical coding biller, and they make it seem like it's something that can be done overnight. But please understand that it takes a lot of training and a lot of understanding in order to do this profession. However, we're going to take it step by step. As I said, it's assigning a code to diagnoses and procedures. And we understand that a diagnosis, I promised I would break this thing down as much as I possibly could. A diagnosis is when a physician tries to tell you based on your symptoms what's wrong with you. And then the procedure is what he does to correct whatever the diagnosis is. And not all diagnoses require a procedure. But as a coder, if there was a procedure done, I code them. So these codes that we assign are based on a classification system. Remember, I was talking about ICD-9, ICD-10, and in my last video I said that now is the best time to come into medical coding because we've just gone, or just started as of October 1, 2015, using the classification system ICD-10. So all of us coders that have been in this profession for numerous years, we started from ground zero, just like you will be, as of October 1, unless you coded in another country. So again, these codes are based on a classification system. And so for example, in acute care, the classification that we use is what we call ICD-10-CM. And I hope you can see. This is the classification. This is the code book that we code from. And no, you're not expected to memorize every single code in this book. But this is just volumes 1 and 2. This is for diagnoses. And then for procedures, most typically in the outpatient setting, we use what's called CPT. And this is for like surgeries, appendectomies, any type of surgery that the physician performs. So there are more classifications that are used in healthcare, such as DSM is used in mental health. And then there's another classification, HCPCS, which is used in dentistry. And then HCPCS is another classification system that's used for supplies that we use in healthcare. We code them based on HCPCS classification system. But we'll be primarily focusing on diagnoses and procedures that are done with a physician in an acute care or healthcare setting. I'm trying to break this thing down as much as I possibly can. So ICD-10-CM stands for International Classification of Diseases, 10th Revision, Clinical Modification. Now when you see the CM, that lets you know that these are for diagnoses. Okay. CPT stands for Current Procedural Terminology. So these are two classification systems that we'll start with. You also need to think about the healthcare settings. At your earliest point of going in, like for a minor sore throat or whatever, we tend to go to our physician's offices. However, when we're a little more acutely sick, we go to the emergency room. Or a lot of times when we can't get in our physician's office because it's the weekend or they can't squeeze us in, we'll go to the emergency room. Another time that we use these classification systems are, for example, with same-day surgery. When you go into the hospital and have a surgery and come right back home that same day, considered same-day surgery. We'd use these two classification systems. And then inpatient setting, when you go into the hospital and you stay for more than 24, 48 hours, it's considered inpatient stay. That's when we also use these two classification systems to code the patient's diagnoses and procedures. But again, all of these healthcare settings, physician's office, emergency room, same-day surgery, inpatient or hospital setting, all use ICD-10-CM. and CPT. And please remember that when we first started out, well, I've been coding since 1998. So, or correction, 1988, telling my age. And we had ICD-9 since then. And with ICD-9, at one time, ICD-9 was the only coding system that we used. And when the healthcare settings, and I try to break this thing down so that it makes sense to you exactly what's going on. We didn't always have CPT, the one that the physicians are reimbursed on. We just recently, since 85 I think it is, started with CPT, because at one time when the hospital was reimbursed, they were reimbursed based on our ICD-9 CM codes, and out of that reimbursement that they received from the insurance carriers or the third-party payers, Blue Cross Blue Shield, Medicare, Medicaid, etc., commercial, based on that reimbursement that the facilities received, the facility was responsible for paying the physician, the radiologist, the lab, taking care of the facility, environmental services within the hospital, the employees within the hospital. And so you can see where reimbursement would run kind of short, and physicians weren't feeling like they were getting their true full reimbursement. So the physicians got together and started what we have now, which is CPT. And that's why when you go to the hospital or when you seek healthcare services today, not only do you receive a bill from the hospital, you receive a bill from your physician. If you had x-rays and the radiologist read your x-ray, you receive a radiology bill. If you went to the lab and had some lab work done, LabCorp, you'll get a lab bill. Because what's happening, these specialists, these MDs, these physicians have gotten smart and started their own coding system. And so now when we do coding, not only do we code for the facility, but we can also code for the physician. So those are the two main classification systems we're going to work with with this YouTube channel right now. Of course, we're going to grow, but I need to try to break this thing down as small as I can. And that's what really concerns me about these quick advertisements like you can be a coder tomorrow. Coders don't make the salaries we make overnight. It's not something you quickly learn. You've got to train for it. You've got to have a good understanding. And that's what we're going to try to do. We're going to try to break this thing down. So, another thing in layman's terms, you need to understand what the difference between a diagnosis and a procedure and what they are. If I were to say esophageal-gastroduodenoscopy, you need to know that that is a procedure and not a diagnosis. However, if I say streptococcal pneumonia, you need to know that that's a diagnosis and not a procedure. So what we're going to do in this class is we're going to break down exactly what is medical coding so that you too, as I said in my previous video, you too can gain knowledge and better understand exactly what to do. So between now and the next video, if you can go on, I recommend Amazon.com. If you have a friend or somebody in healthcare at your local facility or your physician's office that might have an old book that you can use, let's start trying to track down some books. Amazon tends to have them. These books are not cheap. Let me go ahead and tell you that as well. So go on Amazon, see if you can find a used one for training purposes. Find one that's used in good condition. Or, like I said, to a friend or a neighbor or anyone else that might have these books. And let's start playing with this and slowly let's learn exactly what medical coding is. All right, let me double check my notes to make sure I covered everything. Remember I said that ICD-10 is the classification system that we use. And when I say classification system, it classifies diagnoses and procedures. What I'm saying is, you know how you have sourdough bread, pumpernickel bread, white bread, whole wheat bread, rye. All of those are different types of breads, but we classify it as bread. Diagnoses, you'll find that a lot of our diagnoses are pronounced different ways, and that's why we had to come to coding. Imagine trying to put in a computer system that your patient has a sore throat and it was tested and comes to find out it tested positive for strep. Well, I might just put an acutely sore throat. You might put strep throat. Somebody else might put red inflamed throat. To make the computer come up with a classification system that would grab all of this and generate the one code that we need, ICD-10. It will give us one code for all those different diagnoses. And depending on where you live, you'll probably pronounce it or say it differently or diagnose your patient differently. But because of ICD-10, it's going to classify them to one code. And then same thing with procedures. I always like the way I like to say it is that because I'm from the South, I tend to have a Southern twang, and Northerners have a Northern twang. So when we talk, we don't talk the same way. So imagine a computer system, because remember, our claims now are submitted electronically, which means they have to go over through the computer. Well, because of our language differences, imagine the computer trying to classify the way that a northern person would say a diagnosis versus the way a southern person would say it. And that's one of the reasons we've gone to the classification system of coding, ICD-10 and CPT. So we don't have this, she said it this way, she said it this way. It all leads to one code. Okay? All right, let's see if I've got anything else to say. I think that's it. In my next video, we're going to talk about 2 national organizations that will help you become certified in medical coding, because you've got to decide which certification do you want. And the good thing with medical coding certifications is that our certifications are national. And what that means is that if you take a certification in the state of New York for medical coding, that certification is good for any state in the United States. It's good nationally, UK, anywhere. So once you take your exam, your national certification exam, and pass, you're certified. You just have to maintain your continuing education credits to maintain that certification. But we'll talk about that in the next video. But today I just want to make sure you understand what medical coding is. So to summarize, again, it's just to assign a code that can be electronically driven to diagnoses and procedures that mean the same thing no matter where you are. A sore throat is a sore throat is a sore throat. Okay? That's it, friends. Thanks.